Choosing the best sun protection can be difficult with so many options out there on the shelves. And just about as many myths, too. Our own Brooke Lando helps shed some light on which sunscreen to choose in today's Medical Minute.
San Diego summers mean a lot of sunshine and unfortunately bad sunburns or worse if you're not careful. It can be difficult to choose the right protection. Here to debunk some of the myths and to give us expert advice, welcome back to the show, Dr. Melanie Palm. Good evening.
Good evening, Brooke.
All right, so tell us the difference between 30s and 50s. I know so many people are confused over whether or not they need to, if they have lighter skin, go to even 75 or 100.
Exactly. So that SPF number connotes the UVB, which is just a portion of the UV spectrum. That's our burning portion of the spectrum. And really you need about a 30 or more. Say we know that there's a difference between 15 getting to 30 on a cellular level in terms of sort of sunburn cells. But once you get beyond 30, you're already getting like 93, 94% of that coverage against UVB. If you get to 50 or 100, you're just adding maybe a percentage point.
Okay, so not necessarily important to go beyond that,
exactly,
as long as you're getting that 30 to 50 coverage. How much do we use?
So we really underuse. They've done studies, and most of us underapply by about 50%. So one thing that I mention to patients is actually using something called a shot glass rule, which I know
was wondering why
funny,
you had a shot glass with you this morning.
But for full body application, you need about an ounce, which is what fills a shot glass. So most of us are underapplying significantly lower than that. The average sunscreen bottle holds about 4 ounces, so that's only 4 full body applications. We should be running through lots of bottles in a San Diego summer.
Wow, that's incredible. So if you're not going through that within a couple of weeks, really, then you're probably not applying enough.
Exactly.
Okay, but what about the difference between adults and kids? Do we need to put more coverage on kids in terms of the SPF?
So really, no, but we want to make sure, because they're not asking to reapply and they're not thinking about it, but there are some restrictions or recommendations that we have. So under 6 months of age, you just want to shield their skin. We shouldn't even be putting them out there. 6 months through about 12, we really recommend some of the physical sun blocking agents. So look for ingredients that you can actually pronounce, like titanium and zinc. The chemical ones, they do a good job, but they work a little bit differently, and there's a question of absorption as well.
Okay, such important advice, and we'll certainly have you back on the show again to explain more. Really important, especially during these summer months. Thank you so much,
Brooke.
Dr. Palm.
Have a good night.
All right, you too. That's a look at our Medical Minute for tonight.